So we're still talking about the surgical infections, and this section will deal with the source of infections and how to prevent them. So we'll talk about the source of infections. We'll see from where the infections actually develop, what are the factors that promote this infection. Then we'll talk about the decisive period. We'll see what the decisive period actually is, and we'll see what factors reduce the host response to and which reduce the host resistance and host's response to an invading pathogen. Then we'll talk about the major and minor surgical site infections. We'll see what these are and how to manage them. So starting off with the source of infection. So infection of a wound is defined as invasion of organisms into tissues which follow a breakdown of local and systemic host defenses, which can lead to either cellulitis, that is inflammation of the cells, lymphangitis, that is inflammation of the lymphatic vessels, or abscess formation, or of collection, or abscess formation is a collection of pus in an area, or bacteremia is the presence of bacteria in blood. So what happens is an external foreign bacteria, it enters within the host due to the breach in the host defenses. It can either cause cellulitis, lymphangitis, abscess formation, or bacteremia. So it can lead to a superficial surgical site infection. It can also cause a deep surgical site infection. We'll see the demarcation between the two, as in what's the difference between two, and it can also cause the organ space infection. Now, the sources of infection can be endogenous or primary. Endogenous or primary source is present in the host or on the host. For example, a surgical site infection which follows contamination of a wound from a perforated appendix. So in primary or endogenous source of infection, the source was present already within the patient himself, in this case the perforated appendix. Now in exogenous or secondary source, it is acquired from a source outside the body, such as the operating theater. So when an infection is acquired not from the body itself but from the surrounding, it is exogenous or secondary source of infection. So the two important sources, primary and secondary, primary being endogenous and secondary being exogenous. So what are the factors which determine whether a wound will become infected or not? So first of all, we have the host's response. So in a normal adult healthy individual, whenever a foreign agent attacks the body tries to defend itself. So the soldiers, the cavalry of the body, the neutrophils, the monocytes, the macrophages, they attack the invading organism and help the body prevent itself from developing an infection. So it is very important that the host response should be intact for the prevention of infection. Now the virulence and inoculum of the infective agent. Now this is very important, because the higher the capability, the higher the virulence of the inoculated infective agent, the greater the chances of development of the disease. If a mild agent is inserted into the body, the chance of development of disease would be less. However, if a severe, very active, highly virulent agent is inserted into the body, now the chance of development of the infection are great. Now the amount of the inoculum is very important. Greater the amount, greater the chances. So there's a direct relationship between the amount of inoculum of the infective agent and the development of the disease. Now the vascularity and health of the tissue being invaded is also very important. Now, greater the vascularity, the greater the chance of the body to defend itself by recruiting more and more lymphocytes, neutrophils, macrophages, monocytes. Lesser the vascularity, greater the hypoxia, more conditions favorable towards the proliferation of the infective agent and the greater of chances of development of infection. Now, the presence of dead or foreign tissue. Now, dead or foreign tissue, it acts as a breeding ground for this invading organism. So, dead or foreign tissue, it produces a lot of destruction in the area. So this dead or foreign tissue, the body is now the body is already fighting on a front, and the invading tissue, the invading organism now has less force to fight with, because the force of the body, the defenders of the body, have already been fighting the dead or the foreign tissue. So the chances of development of infection, they increase. Now, the presence of antibiotic during the decisive period, we'll see what that is. Now, the presence of antibiotic during this period is very critical and help. If the antibiotics are present, there are less chances of infection. Moving on to the decisive period in itself. So the decisive period is actually a 4-hour interval before the bacterial growth becomes established enough to cause an infection after a breach in the tissues has occurred. So what happens? There's a breach in the tissue. The bacteria has penetrated and invaded the body. Now, after the penetration invasion of the body, the bacteria have to multiply themselves in sufficient amounts. They have to establish a colony of sufficient magnitude, of sufficient amount, so that the body, so that they can produce infection in the body. So it takes about 4 hours for the bacteria to develop in sufficient amount so that they can produce infection in the body. These 4 hours are known as the decisive period. So prophylactic antibiotics should be given to cover this period. So this period should be covered with the prophylactic antibiotics. Usually in gastrointestinal surgeries, we give a second generation cephalosporin, which covers this prophylactic period, which covers this decisive period. Now, the tissue levels of antibiotics during this period should be above the minimum inhibitory concentration for the affected pathogen. So minimum inhibitory concentration is the amount of antibiotic that is required to kill the bacteria, and the quantity of antibiotic should be, or the tissue levels of antibiotic should be above the minimum inhibitory concentration for the expected pathogens. Now, why is there reduced resistance to infection? So the causes include malnutrition. Malnutrition can be obesity or weight loss. So if a patient is malnourished, the defenders of the body do not get sufficient food. So they are lazy and lethargic and cannot protect the body against a foreign invasion. Then in cases of metabolic diseases like diabetes, like uremia, like jaundice, in these conditions, the body is already in a lot of stress. So a stressed body is already overcompensating itself, and an overcompensating body cannot further fight on another front. So it is already fighting at the front, and it cannot further fight or cannot fight appropriately on the second front as well. So in patients with metabolic diseases, there is reduced resistance to infections. Then we have immunosuppressed patients. Obviously, their immune system, their defenders of the bodies have been suppressed, as a result of which the chances of infection in these patients are increased. Then we have colonization and translocation in the gastrointestinal tract. So the bacteria of the gastrointestinal tract, they can colonize and translocate upwards cranially, and this can lead to reduced resistance of infection, usually occurs in an immunocompromised patient. Then we can have poor perfusion in patients with systemic shock or local ischemia. With poor perfusion, the defenders cannot be recruited at the site of infection, hence, there is a reduced response or resistance to infection. Then we can have foreign body material and poor surgical technique, which can lead to dead space or hematoma. All of these conditions, they favor the infective process and reduce the response of resistance. Now, what are healthcare associated infections? So, healthcare associated infections are infections acquired from environment or the staff. This occurs following surgery or admission to the hospital. These are termed as the healthcare associated infections, also known as the hospital acquired infections. So these are infections that are acquired in the hospital from the healthcare staff or the equipment of the hospital. These include the respiratory infections. So these are the infections associated with the respiratory system. These include the ventilator associated pneumonia. Then we can have urinary tract infections, which are mostly related to urinary catheters. Then we can have bacteremia, which is mostly related to indwelling vascular catheters. And we can have surgical site infections as well. Now let's talk about the surgical site infections. What are the major surgical site infections? So a major surgical site infection is a wound that either discharges significant quantities of pus spontaneously or needs a secondary procedure to drain it. So a major surgical site infection is a one that is draining pus. Now it is producing pus actually. Now this pus can be drained spontaneously, or it may require a surgical excision to drain this pus. So production of pus in a surgical site leads to a major surgical site infection. This pus might drain itself or require require excision of that area to drain that pus. Now, the signs are usually tachycardia, pyrexia, and a raised white cell count. Here you can see this is a surgical site infection in which which is left to heal by granulation tissue, and the pus is being spontaneously drained out of it. Now, a minor surgical site infection may discharge pus or infected serous fluid, but is not associated with excessive discomfort, systemic signs, or return in the or delay in the return home. So it is similar to major surgical site infection. However, it is much milder. As a result, it may have slight discharge of pus, or there may be some amount of infected serous material. However, there are no systemic signs. So there's no tachycardia, there's no pyrexia, and there's no delay in the return to home. So a minor surgical site infection mimics a major surgical site infection in the fact that there's a slight production of pus. However, the major difference lies between the systemic signs, that is, there are no systemic signs in minor surgical site infections, and the patient can go home easily. So this was all about this section. In this section, we took a look at various clinical scenarios, and we saw what major and minor surgical site infections were. Important clinical things you need to remember. For further such sections, keep watching sqadia.com.